pagka nagpo-promote ng awareness, especially sa AIDS, ang unang sinasabi nila, bakit natin uunahin yan? Unang-una, hindi naman ganun karami ang pasyente niyan.
With reported HIV infections of less than 1% of the total adult population, it may seem like the Philippines is under no threat from AIDS. In line with the Millennium Development Goals and to mitigate the negative impact of HIV and AIDS on human development, the UNDP in the Philippines came up with a comprehensive program using a multi-sectoral approach.
UNDP wanted to be a little bit different and really look at the whole HIV/AIDS situation in a very holistic way. To really look at the AIDS response from a governance perspective, which is a UNDP niche, and to look at leadership issues, especially at the local level.
Considering the nature of the problem, it's got to be a multi-sectoral or multi-dimensional response, as others would call it. So it's not purely health and it's not purely, say, social services. You have to bring in other interventions as well.
In 2009, the Department of Interior and Local Government, the Department of Health, and the Department of Social Welfare and Development co-signed a joint memorandum for the formation and operation of the Regional AIDS Assistance Teams, or RAATs.
The idea is once a local government decides to start a response or looks for a technical advice, there is a team from the regional offices of the line agencies of government who can be mobilized to provide support to them.
So kapag ang immune system mo ay bumagsak na, meron ka ng tinatawag natin na AIDS.
The Regional AIDS Assistance Team is a good example wherein a country identify what needs to be done regarding a concern and then come up with a response which is locally based.
The establishment of multi-sectorality.
Aside from working with national government agencies through the RAATs, the UNDP also engages the local government units directly.
We also try to identify governors or mayors that take a stand on HIV publicly, and then we go and we provide them with direct assistance.
One of the areas that was chosen for its strong leadership initiative is the province of Albay in the Bicol region, where the local government is bent on achieving the Millennium Development Goals.
Kung gagawin natin Albay maging livable province, dapat pati ang health sector, ang health services, mapaganda. Ayaw naman naming magkaroon ng aksyon o umaksyon lang na andyan na, marami na. Mas mahirap. Kasi diba, tama, we prevent instead of giving cure.
Local governments are able to be in a better position to craft a more effective strategy because they know their area, they know how communities would handle these problems and the kinds of vulnerabilities also that are present in their respective areas.
In Albay, the local government has responded through various means. Bars and nightclubs have been confined to assigned zones, making it easier for local health centers to work with them in monitoring cases of HIV and sexually transmitted diseases. Aside from enacting local policies, local AIDS councils also support dissemination of information about HIV and AIDS not only among high-risk individuals, but the general population as well.
The regular program built in the rural health units, the outreach program, meaning to say, they go to the community, they do the regular 101, HIV information and education.
Sa lawas kang tao na pwede kong makaulakit kang HIV. Kaya mag-urulay ko ka. Okay. Yes. Bakit po? Yes, Annalyn.
Malaki ang improvement in the last 2 years with regards to localizing the response on HIV and AIDS. Kasi ngayon gumagalaw talaga yung region.
The developments in Albay are encouraging, and this is only the beginning. As UNDP works hand-in-hand with national agencies and local stakeholders in building leadership and strengthening capacities, sustained local responses will rise to the challenge of halting and reversing the spread of HIV and AIDS in the Philippines.